Thank you very much for the introduction, and thank you very much for the invitation to contribute to this wonderful conference. Maybe I will start by explaining a little bit more about Age Platform Europe. That's indeed the largest network of older or senior citizens organizations, as you would call it, and it's actually our members who are representing directly 40 million people aged 50 plus. We even have organizations representing the 40 plus excluded from the labor market because they're considered to be too old. So we tend to be very complementary with the European Youth Forum, who represents young people until the age of 35. And there is only 5 years where you are left without an organization at EU level who would represent you, and then you can jump straight into Age Platform Europe. But the bulk of our members, they represent, I would say, not only the 50-plussers, but even the 60-plussers, and so. So the Age has existed now for 15 years. This year is our 15th anniversary. And it has grown in importance at EU level, but also what we have been able to achieve over those 15 years is getting much closer not only to national organizations who are working and representing older people to try and influence policymakers, but we have been able to reach now down to the local and regional level as well, and I will come back on that. Just a couple of years ago, when we heard about this conference being planned and we were asked to join as a partner, as you notice, Age is among the list of supporters of the conference, we were really very pleased because that was exactly the topic which has become now our key priority at EU level. And we certainly wanted to support very strongly the conference, but also to be able to use it and refer to it afterwards, refer to every single presentation afterwards that would bring us, as we call, evidence or ground to support the claims we are trying to make, both at EU level, but also at United Nations level, at the Council of Europe level, because that's where we are working. But also to bring it down to the partners and the large group we have been able to mobilize through the Covenant on Demographic Change, the European Covenant on Demographic Change, which has been launched very recently, and actually its president is here, Furio Ansel, who is the mayor of Udine, is here, and we have a large group. 12 out of the 15 board members of the Covenant are present in the conference, and we'll meet later on today at the City Hall of Groningen, and we thank the City Hall very much for their welcome. The reason why we were also very pleased was that already 2 years ago we knew that this conference would be very timely. It's very timely because you will hear from also the next speaker, Lambert van Nistelrooy, who is a member of the Parliament and very strong supporter of older people inside the Parliament. You will hear that there are several key EU processes going on where each time we are able to push a little bit further toward the dream that we all share, I think. That means to be able to enjoy life until the end of our life. That's a dream that I think all generations share. Maybe younger people are not so aware of what it means to grow old, but here in this conference, all ages, doesn't really matter, all of the participants share the same vision of what needs to be done and what can be done nowadays to really create what we call a society for all ages. It is very timely also because we have just published as Age Platform Europe a guide to the right to the city and how this relates to older people. We issued this guide to mark the adoption of the Pact of Amsterdam, and you will hear more about it very soon, which is an initiative that you more than welcome, and which is also meaning that hopefully something will be done as in the framework of the urban agenda of the European Union with regard to the needs of our aging populations, because there is one reference somewhere under item 12.9, which refers to demographic change. It was a hard battle to get it in, but it's there, and it means a lot, I hope, for the future. that there will be welcome changes in terms of political attention paid to the needs of our aging populations. What we like very much about the program, I must say we were very impressed by the quality of the program of this conference. First of all, for me, and I've been working for Age now for 14 years, it's the first time ever that I see different stakeholders being brought together in a single conference and talking to each other and listening to each other. That means not only the medical professionals or the architects or the policymakers or the innovators or the founders, but all of them together. That is quite an achievement, and I must really congratulate Franz Jasper for having achieved this. It's exactly what we try to encourage things to happen also at EU level and down to the local level, is that the different stakeholders must really get together, agree on the vision they share, agree that each of them have a role to play, and then agree to play that role. And that's a little bit what is behind the campaign that we have been running. We started back in 2008 with an agreement that Age Platform signed with the World Health Organization, which has developed, as you probably know, a methodology to create age-friendly cities and communities. The approach they had developed was developed in very close consultation and with the participation of all the people themselves, and which is a crucial element for us. And they developed together in many cities around the globe a methodology to help the local policymakers to become more age-friendly. That means to respond better to the needs and expectations of the aging population. We go one step further by saying when we create age-friendly environments, when we seek to create a society that better responds to the needs of its aging population, we actually must take the broader perspective, which means looking at the needs of all the population groups. But we are convinced that by responding to the needs of the aging population, we actually help the younger populations as well. So now we have translated age-friendly environments by meaning friendly to all age groups. And that is something that we appreciate very much, I would say, in the approach that Groningen is taking. We have heard about it yesterday. It's a city which is at the same time the youngest and the oldest. In the Netherlands, they have a very large group of very young people, and it's wonderful to see the livelihood of Groningen, but you have also a large number of aging people. And that's the dream of older people, the way they express it, at least among our network. It is that they don't want older people to become a separate group looked after in a ghetto or in a separate society. They want to be part of their community until their last day, and to have young people around them, middle-aged people, whatever, everybody around the community. They want to stay where they have lived with their children and where they have spent their adulthood, I would say. This is the dream we have of where the community we would like to live in. Even if you develop dementia, we have heard Prime Minister Rutte yesterday explaining or reporting back from a visit he made in a dementia-friendly community near Amsterdam. This is exactly the approach we would like to promote. If you want to develop age-friendly environments and adopt the WHO approach, it means you do not only look at caring and curing for those who are ill. The focus that has been put yesterday, at least, and I'm sure looking at the presentation in the book that will take place today and tomorrow, is very much on prevention, preventing people from developing health conditions which will become difficult, preventing, of course, chronic diseases, but also helping everyone age in good health and enjoy life. That's, I would say, even better than good health, because, of course, diseases develop over time, but being able to continue to function in your normal area, being able to continue to participate, fighting barriers that are becoming more and more difficult to overcome when you grow older and you develop, for example, mobility problems or cognitive impairments. That is exactly the dream we share with the 135 members of the newly established Covenant on Demographic Change. Many of them, I would say a majority of them, are public authorities who are very committed. Other, they have already done a lot in the field of age-friendly environments and are happy to share their good practices, to be able to see how others are doing maybe even better, and they can learn from them. But the Covenant is not a club of the best performers. It's open to everyone. It's open to all public authorities, to research centers. It's open to civil society organizations. Every entity or organization which feels that they have a role to play, and that includes the industry very much, that includes innovators and founders, they are more than welcome in the Covenant. The purpose of the Covenant is to support the WHO global network of age-friendly cities and communities, but we go beyond. We do not focus exclusively on the local level. We have identified that it's very important to have a good coordination and to make sure that the different levels of governance in a country share the same vision of the society they want for the future. And again, the Netherlands here is a very good example. For those of you who were here yesterday, you heard your Prime Minister. It was so obvious that he shares the same vision as the city of Groningen, for example, about what needs to be done. When you have a good coordination and understanding and a sharing of same vision among the different levels of governance in a country, that's where things are going much faster. And this, for us, because we are outside the Netherlands, is a good example of what the Netherlands is able to achieve, because they share that same vision and they know exactly where to put their money, they know exactly where to go, and they have this long-term vision. In other countries, you have sometimes differences of priorities between the different levels of governance. Then it becomes very, very difficult, and the impact you can have at local level, that means the level where you have a direct impact on the lives of citizens, is much more challenging. You can do things, you can improve things, but it's more complicated to really get the full picture of it. The conference is also very much linked to another process which is taking place at the United Nations level, which is called Habitat 3, where there is also a reference now to older people and the need, recommendations made to member states to really take on board the needs of the aging population. It's very funny in a way that demographic aging is the elephant in the room that everybody has been able to see coming and getting bigger and bigger in the room for decades, unless it's the challenge, the societal challenge, that in some countries is the least addressed. Why? Because of the short-term vision that sometimes policymakers are forced to take, not because they don't like to plan on the long term, we are not blaming them, but because the system is built in such a way, and this lack of coordination and common understanding between political parties and between level of governance is not strong enough to ensure that whoever is in power at whatever level of governance, the same vision will remain and everybody will continue to work on that. So what I wanted, and I will conclude on that because I'm sure Marcel is going to run after me if I go further, what we are trying to promote through the campaign that AGE is running as an organization to create what we call an age-friendly EU. We do it also, and we support very strongly the newly established Covenant on Demographic Change, and there will be a session actually at 1 o'clock, from 1 to 3, a combined session with the World Health Organization, the regional office for Europe, which will deal with age-friendly environment and will give you some concrete examples of what local policymakers are doing, but also showing you the broader picture of what WHO is doing to promote active and healthy aging. And you should really listen to that because they have really moved a big step forward, and they have a strong strategy for the coming years, which will support you. It will give you ammunition to be able to move forward on what you're trying to achieve. I will conclude by saying that it's been really a pleasure to work with the organizers, to organize at the same time the first board meeting of the Covenant on Demographic Change. For us, it's good omen to have the first board meeting in such a context, and we very much welcome to hear more about you even after the conference, because the conference is a fantastic opportunity to learn about each other, but you cannot split yourself in four. The program is so rich that we will need to come back to some presentations afterward that we have not been able to cover. But I'm sure with the support of the organizers, all this will be available for a long time after the conference, because believe me, for us it's very, very precious information and data that we can use afterward to promote better policies at all governance level, starting from the UN down to the local level, to really create a society for all ages where you will be happy to get old, and I'm sure not only me, but also my 6 grandchildren will be happy to grow old. So thank you very much for the opportunity to speak to you.